Whether you're vaccinated or already had the virus, breakthrough infections and reinfections are becoming more common. Our fact check team joining us now with what you need to know when it comes to the risks.
Back now once again with the fact check team. And John, tonight you did some researching, a deeper dive into a study that compares both of these different immunities that we've been talking about tonight.
Right, so as we get into this discussion, vaccine immunity, natural immunity, one of the things that comes up is just what the risks are. A study out of Kentucky found that folks that had been sick with COVID-19 in the first part of 2021, both with and without the vaccine, those unvaccinated cases had 1.5 times to 3 times the odds for reinfection by May and June of this year. That same study said that the immune system might have more of a response to different variants after vaccination than from natural immunity, but there isn't enough data to lock that in yet. Now, Dr. Marty Makary, a doctor with Johns Hopkins, most recently talked about how the Omicron variant being top of mind for that reinfection or breakthrough infection might not be as big of a concern as you think. His read on the new variant is that this is, quote, far more mild. That's why he's calling it omnicold, citing research from Hong Kong. Now, while Dr. Makary is less concerned than Dr. Michael Chan, who actually led the research team, says that, quote, by infecting many more people, a very infectious virus may cause more severe disease and death, even if it's less severe. With that in mind, researchers and public health professionals point to either vaccine immunity or hybrid immunity as the right direction to take.
And hybrid immunity is when someone has recovered from COVID-19 and then is later vaccinated. So how many vaccines does someone need if they have recovered from COVID-19? Well, Medical News Today points to research and says people who have had COVID-19 and later received the first dose of an mRNA vaccine developed exceptional immunity against a wide range of variants of the virus. They also point out that people who have not had a natural infection, but a third shot or a booster may provide similar broad protection. Now, the science journal Nature reports other countries such as France, Germany, and Italy have advised only 1 dose of vaccine for people with a healthy immune system and a confirmed previous diagnosis. In the States, things are a little different. We typically don't take into account previous infections when it comes to doses. The CDC recommends the full series of vaccinations for people who have had a COVID-19 infection to ensure a more predictable immune response.
John and Janae with tonight's Fact Check team, thank you for breaking down this important topic for us tonight.